This is where I get frustrated.
Don't even open that can of worms.
Like horrifying.
Horrifying. Not allowed to cry or have emotions in your house.
Like, do you really need to know what Zimoglyphosate is? Or
Oh, Jessica.
everyone has a favorite. Everyone does. Today is an exciting day.
Super
we
exciting.
have Dr. Hernandez back. She was here, gosh, in the beginning. Like, I don't know, like months ago.
Months ago.
Like
Yes.
talking about all this scientific shit that I couldn't pronounce. Anyways, but today we are talking about Evoke and DNA mind testing. So
Yes.
exciting.
Yep.
So let's first define what each are. Each is.
Each is.
Each
Yeah, I
is.
believe that's the
Each one.
correct grammatical
Yeah,
way to
I
say it.
whatever.
have no idea.
Yeah, we aren't English majors. Okay, what each is, so the people like me can like understand.
Yeah.
So swinging it over to you, girl.
Okay. All right. So there are two big things that I think benefit the psych world when it comes to what we do. And so y'all have had experience with all of this.
Yeah.
So the DNA Mind is one of the panels that we do, which is what we call our genetic panels. Okay. So it's sort of termed like nutrigenomics. It's not scary genetics, but it's genetics that you can look at your pathways of how you've been born, right? How you're made from your mom and your dad. And then those genetics can tell us where are there strong genes and genes that are not as strong.
Right.
What is that, like strong genes meaning?
That variation of gene that you have in your DNA that you were born with in the population data, that works really well for that person.
Oh, okay.
We know
Works
that
with
the
you.
outcome is good.
Okay.
Right? It's going to be a strong outcome.
What's like I don't know, like an example?
Okay, so for example, on our DNA Mind, one of the little fun tests that is on there, one of the genes is 2 genes that test for your stress response. Okay, so usually we know if we handle stress good or bad, right? You may not, and it's really cool when we do this on like a baby or a 2-month-old because then I can tell the parents like, I'm warning you,
Yeah.
be patient, or hey, this kid's gonna be great, like rocking and rolling, nothing's gonna bother them. Okay, so that's kind of cool. But the stress response is an example of that, right? You might have a little check by your stress response, like I do. Maybe y'all, I don't know.
I know, I'm pulling mine up now.
don't.
Okay, yeah, take a look at it. And then,
it's
or
on here?
your
Oh,
DNA.
I didn't do the DNA.
Yeah,
You didn't do the DNA?
No, she did. I don't think she did.
Oh,
I think
we're
she
just
only
gonna-
did the
we're
Evoke.
just gonna kick you
Well,
off.
it's going to be a negative or not a check. Either way. Go
Well,
ahead.
you can have up to, so we call dots. Dots is how the algorithm shows if you need help on that gene or not. Okay, so it's in dots. The more dots you have, the more help you need. Okay, and so if you have 6 dots on that stress response, it's like, whoa, these are kids or adults that really need a lot of tools. That's where you come into play, right? Go see the therapist, go get some support, learn some things you can do. So that's an example of one of the things on the DNA Mind that can be helpful. But basically, if you need support, like for neurotransmitters. So that's really, I think, in y'all's field, the biggest, coolest part of that test is it their dopamine that needs help? Is it their serotonin? Is it their neurotropic? Is it their GABA, right? All of those do different things in the body.
Neurotropic and GABA?
So, all right, start at the top. Dopamine is your neurotransmitter, right? It helps with your focus and your attention and that reward pleasure.
Yep.
Right?
Okay,
and then you have GABA. It's kind of like your calm, kind of chill out hormone. Okay. So like when you drink alcohol, you get that GABA effect. Okay.
Right.
Then you have neurotropic. It's a gene called BDNF. So it's kind of like a norepinephrine. So it's going to be like your go, go, go. Kind of like those, if you need help there, you're going to like need that movement to keep motivated.
Okay.
Right.
Okay. Got it.
Right. Okay. So those kids that are strong in that or adults, they can sit still and really like, or go play sports and really be into it. Have that competitive edge.
Oh, okay.
Serotonin's happiness, right? So if your serotonin is lacking and you need help with that genetically, then you would want to support that. And so you can look at those 4 and sometimes kind of see what medication would be better for that person if they need medication.
I need to do this thing.
Or
it's super cool.
I feel like I can write it off.
of course.
Sure, you could try it.
Sure, why not?
It's like
it's worth
continuing
trying.
ed.
100%.
Whatever, for sure, yeah.
So then the top part is inflammation, right? So that's a huge topic we could go on and on. But if the top part of the panel is lots of dots, right? That kid needs a lot of help or that adult needs a lot of help with inflammation and their neurotransmitter pathways look great, that's a kid that probably doesn't need a medication.
Okay.
And if they're on one, that's probably the wrong thing to do because that kid is all a bundle of inflammation and medicines aren't going to fix that.
Yeah.
Right.
That's where lifestyle, diet, changes,
parenting,
comes into
whatever,
play. Right.
environmental stuff.
So it can really help guide a lot of
Like treatment plan
for
of
us
care.
that we do, supplementation, diet, lifestyle, and then medications as well.
Yeah.
Okay.
It's very clear cut DNA. That's the genetics. And we also have a ton of other panels, but that's the one that we would pair with the Evoke.
Yeah. So let's talk Evoke.
Evoke. Okay. So Evoke is a QEEG. Okay. So an EEG is a brain wave reading of the brain. So you're just sitting there and you're putting on this little hat. It has electrodes and the electrodes are all placed in a different spot. So each electrode reads a different brain signal of the, of the brain. And the actual test process is, it's about an hour, but the actual part is like 20 minutes.
Yeah, I was about to say. I don't think mine was an hour.
It's pretty quick once you get everything set up. And so it is a functional test to see and map the brain. So it tells us, a bazillion things, but really it tells us how the brain is functioning, where there are deficits, okay? And then it tells us like the ability for the brain to process information visually, auditory, right? It tells me how fast you're processing the information. So if there's a lack of, tells me if there is it tells me different wavelength and frequencies. So your brain processes in delta, theta, alpha, and beta wave frequencies. And all that means is like your brain at a slowed, tired state versus your brain on like a really alert state, like you're taking a test, right?
Okay.
So it's like the slow to the sleep, all the way to like your brain being really on. And that's the wave frequencies. So it will tell us where the issues are in what state of your brain. Okay? This kind of makes sense.
Yeah.
Sort of.
I got distracted and so I'm lost, but that's okay. Keep going.
I think examples of this is how I can explain it the best.
Okay.
I think when I go through that, it's kind of complex, right? Neurology and EEG and that whole world is complicated.
Yeah.
Even when I was in residency in med school, like I was like, I can't read an EEG. Like that's for the people that know how to do that, right?
Yeah.
But this test is actually the Evoke, the company Evoke Neuroscience, maps out the EEG for you and makes it into a brain map, which we will show you guys.
Yeah.
And it's visually appealing in colors.
Yeah.
And you want it to be green.
Yeah.
And then when there's red, it means there's too much power.
Okay.
And
what
when
does
there's
green
blue,
mean, though?
green is normal.
Okay. So meaning
is
like, green is good. I know that. But what is the definition of good?
The definition of good is that your brain frequency is very stable.
Stable.
In
Okay.
that wavelength.
Okay.
So you don't have too much power or you're not lacking in the power.
Okay. As it relates to whatever moment or skill you're completing at that time.
And this is from billions of data points,
Yeah.
right? Of all of the data that they have.
Yeah.
What is the normal wavelength, the
Output,
frequency from their
or-
studies that they did?
Okay.
Yeah.
So
The
red
coolest
is
thing-
it's working too hard.
Red is like too much power. So depending on where the red is, gives you a different answer for what's going on.
Okay.
And then if you're looking at a brain as a circle, right? Our brain is a circle. It depends on where the red is in the picture, right? And then you're going to look at all the pictures and then it's going to help you really visually. And the more I have done, I've done, maybe a couple hundred of these at this point. So the more that you do, it becomes a lot more obvious to your eyes to pick up patterns.
Yeah.
And so that's really, sometimes, it's hard for me to explain exactly what, but when parents are seeing this, and especially when we do repeats and they see the red go away, they're like, oh, this looks better. They know this means it's better,
Yes. Yeah.
And when the whole brain's red, which I've had a few times, the parents know that, okay, there's a lot going on and now we got to really hunker down and
like it's
do the thing,
And I feel like, especially for people like me, I don't know, like you can go to a therapist or a psychiatrist or a doctor or whatever, and they can tell you words, but when you see it, like when you see
100%.
science on like paper evidence, you know
evidence.
what I mean?
Yes.
Like numbers, and it's like you can't, there's no bias or like transference or whatever. And so it just like solidifies, like you can't
talk yourself out of it.
Thank you.
Right.
That's what it is. It's like you can't talk yourself out of it, or you can't excuse something.
Exactly.
Like you have to take accountability and go and do it.
Well, and it like validates
Yes,
what you're
and validates.
experiencing.
Yes.
It's like, okay, this is not. I was about to say this is not all in my head. It is in your head, but it's in your brain. But it's like I'm not like making this up. Like this is there is a real issue
Correct.
going on.
Yes.
And
that was that was the reason I did the Evoke.
Yeah.
So I was like, am I like a like literal paranoid psychopath, like whatever. And it was like, no, you're not. Like your whole brain is filled with trauma. And like, here's evidence.
Yep.
Okay. So let's go into some like cases or whatever we call it.
So I could go on for days. So let's start with some. So I want to start with my son first really quick, just to give the personal. So just a background on me. This Evoke was bought for NuWell, and it sat in my house for about 4 months. I was super intimidated by it, and probably how you may have felt in the beginning. And I didn't want to open it or explore it because I had not learned about it in medical school, right? I knew what an EEG was, but I did not know what an Evoke was, and how was this going to help me with my patients seeing pediatrics. And I was reading studies, and I was starting to be like, okay, I need to try this out. So I went through all the trainings and all. And then my first person that we did this on, so we did ourselves, some of the adults in the clinic. And that was really cool. I guess personally about me really quick, I don't know if you were on it or not. When the neurologist read mine, he basically was telling me everything that I knew. And I looked at him and I said, did my husband tell you to say this? It was like, slow down. You're working too hard. You are the type that just wants to work, and you're going to wear your brain out, and you need to take a little step back. And I was like, really? You don't know me. Like, how do you know that from my brain? So that was cool. And then I did my son. So my son was probably 11 at the time, and he's wonderful, but we always knew that his brain worked a little bit different. And teachers had told him that he had ADHD, and even teachers sometimes at his school where he's at now were like, dude, did you forget your meds today? Like, come on, wake up your brain. And poor kid, I'm like, you don't have ADHD. You've never been diagnosed. Now, maybe I suspected some of it, or that like slow processing speed of his brain. And so when I did this Evoke, and I was like blown away. I remember telling my husband, I mean, it was just like so satisfying to me, because I did not evaluate him. I did not put him on medications, despite what everyone had told me, because I didn't think that was the right thing for him. And when I got the Evoke back, what it showed is that he had 0 signs of attention deficit. There was no frontal lobe issues at all. He had auditory processing delay. So his only issue in his whole brain was that auditory wise, he's slower, which is why visually he's very strong. So he reads a book a day. And, he needs sticky notes to remind him of things. And me telling him to do something is not the best way to communicate.
No, and I think like as it relates, first of all, like so unethical when I hate when teachers like say things like that. Like, whatever. So that. And then secondly, I think people either forget or don't know or get confused about like symptoms. You know what I mean? It's like let's say someone appears inattentive. That could be a symptom of something else.
A million different things
that like may not be in a DSM or any sort of medical book. It could be because you have too much shit on the wall. You know what I mean? And so it's like we're just so fast to find the easiest, quickest answer.
Yeah. So, I mean, if I was anybody else, he would have been evaluated. He probably would have had the diagnosis. That's easy to get, right? And then the treatment is medication. And he would be on a medication that he never needed. And probably have side effects from that medicine, just like everybody else. So it was cool at the moment. I was like, okay, I think I like this test. Like, I think me and this test can really get along. It nailed me. It nailed my son. So let's keep going. And then I started doing it on patients. So,
okay, great.
Okay, so I have a couple here. Okay. Let's talk about this kid real quick because he's pretty cool. So this is a 4-year-old little boy, and actually a little backstory. The mom is awesome, and she's a very big advocate for her son because she fostered him and then adopted him as a baby. And he was born to a mom who was on opioids and had exposure to alcohol as well. So she knew early on getting herself into this kid was going to have some problems, right? And she was going to have a challenging road with him. But he's actually doing really well. But she knew she was like, there's just brain stuff I know with him. Like there's just things. He'll throw things at her face. He gets really crazy. He'll run away, So we did a bunch of testing on him, but we did do the DNA panel, including the mind, and we did do the Evoke on him. And so I don't know if I showed you this, Jessica, but this is his pre and this is his post.
I mean,
and
he was like kind of okay before.
Exactly. So no, you're actually
better than you would think.
So back to what you said, when I showed her this, I said, look, I know you are coming here telling me he is like, I mean, she was explaining him like he was a 10 out of 10, right? The worst situation,
so
and blaming a lot of his exposures on this. But I said, I was like, this looks pretty good, you know?
Yeah.
So that was, I think, a big moment for her to be like, oh, okay, like but she also has 2 kids a year apart. And so that's a challenge, right? Because they feed off of each other.
Yeah.
So I said, separate him, do him just alone sometimes, have alone time with him and see, because I mean, he's great when he comes into the office with me, but I get it, right? He's a kid. So anyway, but there was some right here in the red. This is what you can see with what appears like ADHD type symptoms. So focus, attention, and then that impulse, you know, and she always says he's like seeking that hit of something, right? That she can see that addictive personality and behavior. But he was central. So he's more at the top, and he had central. And so central means that the whole brain all the way is affected. And so we knew it was some kind of past exposure back to birth that was causing that. You repeated it after she changed up the diet. So she less processed food. You know, she's doing a really great job getting better sleep. Parenting him probably a little bit more patiently.
I was about to say, what? Yeah.
Instead of screaming at him and yelling at him and, you know, and then she has him on a lot of supplements that we had recommended, including omega fatty acids, some anti-inflammatory, some vitamins, vitamin C. He's on a methylated multivitamin and L-theanine and some other supplements that can kind of help calm down the brain a little bit. And then this was his repeat. And I was telling
what's
6 months apart.
Okay, great.
Wow.
And she, you know, called me in tears and she's like, really? Like it got that much better that quick? And so when we met with the neurologist the other day, you know, he's like, yeah, I mean, brains, kids are so plastic and they're so
malleable.
Able to heal the earlier you try to intervene.
Yeah.
You know?
Did she, okay, so 6 months apart, she was crying, right. Is she seeing a difference behaviorally?
100%.
Like how? Can you talk about that a little bit? So
she says that his ability to regulate and not have these huge outbursts and go from 0 to 10 are so much better and so few far in between.
Oh, great.
Now,
awesome.
He has triggers.
Well,
so there are
we
things that trigger him and she knows that he's going to do his thing.
Yeah.
But for the most part, like his whole just baseline is better.
Great.
And that's what I told her to look for. I said, look, kids, it's kids.
Yeah.
Every day they're going to have a bad day, a good day. But the baseline should be improving.
Right. Yeah, great.
So she was excited. She actually was like, hey, I want to come do this. And so we got her in to do it because she knew that we would see a beneficial result. And then for her, she is a big advocate in the opioid community, and she's on the board, Geno, which is trying to raise money and get grants for other kids that have this issue too, to be able to help them.
Yeah.
And
like
so,
drug-exposed newborns?
Exactly. Yeah. Exactly. And so seeing that our program and what we do at NuWell can help him so fast, she was super pumped and motivated to spread the news to her organization.
How young can you do this?
So the company says like 2 to 3 years old, and they have done it down to that age. I think the youngest we've ever done is 4.
Okay.
It can be challenging. I've had to repeat a few, but if the child is able to sit there, even with the mom kind of on their lap or giving them a hug, and the mom's able to keep them calm, they just can't move too much.
Yeah.
That's the big thing.
Yeah.
Well, and they have to be able to do the test with the...
So we don't need that part.
Okay.
So
that's what I was going to ask. How do you do that with a kid that young?
So we don't do that part.
Okay.
So there's a 5 minutes eyes open, 5 minutes eyes closed.
Okay.
And if you can get those 10 minutes of data, then you have enough data to really be able to map the brain.
Okay.
You may not be able to get that response speed and those commission omission areas, which is more for ADHD type things.
Right.
But the brain, where like this picture right here, this is all from the 5 minutes eyes open, 5 minutes eyes closed.
Oh, okay.
Okay. So, like, is there any way that you could do it on someone young, like a baby?
I mean, you can do an EEG on a baby.
Yeah.
And so I would say it would probably be something you would want to try and see if they can read the data.
Yeah.
I don't know.
I just wonder, I think about like NICU. You know what I mean? Like any like NICU exposure and like as it relates to stress response and like attachment and whatever. Like both my kids are NICU.
Yeah, they do EEGs on NICU babies, on babies all the time.
Yeah.
To look for seizure activity.
Yeah.
To look for brainwave activity.
Yeah.
But this is going to be looking at a lot more sensitive information, right?
Yeah.
Not just are they having a seizure or not.
Right.
Yeah.
You know, so this is going to say like, well, they're not at seizure, but what else is going on?
Yeah.
So, like, I mean, I'm, again, just selfishly thinking because I just am self-absorbed. Like with all three, sorry, one of mine done. 2 NICU kids, and I'm also just like a scientist. Like, I just love fucking all that stuff.
It's so cool.
It's so cool. Like, doing an Evoke went like day 1 of NICU or whatever, like in the NICU, and then 6 months later post what's it called?
Discharge?
Yes, post discharge, 6 months later doing it and seeing like how, like if there.
So did your twins have MRIs or EEGs in the NICU?
Mm-mm.
They didn't? Okay.
Shit, I don't
know. They probably had something, I would bet.
I don't remember.
Because you're looking for any brain bleeds. You're looking to make sure there's not hydrocephalus. Like usually they get scanned.
Yeah.
But as far as having a functional EEG, now I can't confirm this, but someone had mentioned that our local hospital carries some of these. So I'm not sure exactly the data that they're doing and how young they're doing them on.
They're doing Evokes?
Children's.
Really?
Oh, they are. Mine were the other ones.
Somebody told me that. So. Yeah, and I'm not sure, who has them and who doesn't.
Not.
But it was very interesting because,
like they have them and they're not using them.
No, they have them and use them.
So they must be doing some kind of research or something.
I think so.
Yeah.
Interesting.
Yeah, Evoke is big. So the military actually has a contract with them, and so they do pre and post on every single person that is in the military. That's their big
not know
grant.
that.
But like pre and post, like why can't I think of words? Deployment.
Well, just entering in, right? No matter what your job is or what you're stationed, they do a pre and a post.
I
So,
should have been
and look, they should do it on athletes, right? That would be really cool to look at pre and post athletes and to see what damage is going to happen.
Like
CTE?
Brain injury,
Wait, CTE? Is that right?
Yep. So it's actually, so it's FDA cleared for dementia and for ADHD. And so
not autism? I thought it was autism.
It's not FDA cleared for autism.
Okay.
Now, I have a good handful of cases where we have seen some patterns of autism on the Evoke.
Yeah.
A few times I had that conversation with the parents. And again, it's not diagnostic, but it's just, and one specific case, I know Lauren knows this family, and they, they were very blown away because it was actually helpful for them because no one would give them that diagnosis, but the mom really suspected it. And it was kind of clarifying for that family. She was very happy.
Yeah.
A few other people, you'll mention it and they'll say, no, I don't, suspect that at all. And I said, okay, just something to think about.
Yeah.
And then a few other times it was pretty diagnostic, early on. So that can be helpful. Or if a family really thinks that is the issue and it's not, and we don't see any signs of it, and you're like, okay, maybe that's not really what we're dealing with here. And we need to explore other things.
Yeah. Okay. Cool.
I almost wish now we would have printed out my son's before and after, because he did it before and after, and it was
do you have your before after?
I didn't even think.
We have mine in there, but I don't have his. But when you were talking about the changes for that little 4-year-old boy, so the way we kind of got to the diagnosis of part of it, of like the PANS pandas for my son, was the Evoke, that he had inflammation everywhere on his Evoke. Right. And we did, a ton of we did do a lot of treatment. Like we did a lot of rounds of antibiotics and anti-inflammatories. We did a mold detox. He's on a bunch of supplements. But when we did the repeat, it showed actual visual improvements. And it's, what we're seeing in real life. I mean, it was it's kind of mind-blowing because I think it gets a bad rap.
Really?
Right? Yeah. Oh, yeah.
Evoke?
Yes.
Who?
Yes.
I would say in the medical community and with, I think maybe in you guys' field, because it's, and maybe it was why my hesitation to open it up and work with it, right? Because you just hear that it's not reliable or why it's not FDA approved or the science is lacking. But I have personally read and shared with you a lot of the actual studies that are done on adults and kids, and there is science. This is a actual medical proven technique. And it's huge in so many, the whole military is benefiting from it. So it shouldn't be. I think people are just intimidated by it.
Yes, I agree.
Right? And that's why a lot of things get a bad rap is the inability to know what to do with the information.
Yes.
And that was where I was. I didn't know what to do with it. I was intimidated by it, which is why I was hesitant to even open it. So I may have said, well, I don't know what that test is.
Yeah.
That's baloney,
Yeah.
But if you learn something and learn how to use it, and every time I've used it, it has been helpful. I've never done it where it hasn't been extremely helpful. And then it's a wonderful conversation with the parent because every single time the parent is like, this was totally worth it.
Yeah.
It was so helpful.
Yeah. And listen, I'm not to like be whatever, but like we have different views on a lot of things. But this I like truly like believe in.
Yeah.
And like also like this like I said before, like you go into any sort of MD or psychologist, like even though they're using like batteries of tests, there's still some bias.
Yes.
You know what I mean?
And like
it's
always objective at the end of the day. Yes.
Anyways, so that surprises me.
I know.
That, like,
I mean,
people,
for me,
like, what?
It's been so helpful for me because I don't have a window into people's brains. Otherwise, you know, like there's no like lab test I can do to say, oh, you for sure have depression. You for sure have anxiety. Like I have to base it off of clinical experience and interview, et cetera. But this has been a window into the brain that I've never had, and it definitely changes the course of treatment. Like 100%.
So you know, I do the kids primarily, but for the adult world, something really cool that my colleague, Dr. Sapansky, who works with NuWell and owns NuWell in Florida, what she told me one time is she says, Lauren, I use it the most because these adults, even these males, will come to me and they're really struggling. And they may think they need an upper, right? They might need Adderall because their brain is struggling. But they actually might be too high and a stimulant would be the worst thing for them. You need to calm them down and lower them, right? Yes. Or they might be thinking they need an antidepressant and at the end of the day, they're all blue and they need an upper. So that in of itself has shocked her so many times with people because you just really need this, you know, to be able to tell that. And it's not always clinically what you would think. And you do this and you're like, whoa. It's different. And then you know for a fact what your first option if you're going medication is because it's going to work instead of trying 3 things before you get to the result.
Just real quick question. Can you see like personality disorders on that?
So you can see bipolar and
like mood disorder stuff?
I've had a few times where they have suspected, it wasn't a patient of mine, but it was a patient of my colleagues, where they suspected some early signs of some bipolar, and there was bipolar in the family. And she was an interesting case. And actually, one of the things that they had told us to recommend to the family was to get rid of all the Wi-Fi hotspots, right? So it's a little odd, but it made a huge difference with this kid.
And how old was the kid? Do you know?
Maybe 10 to 12.
Okay.
And it made a huge difference for them. And we did other things as well. But it was the mom had just went out and bought like 8 hotspots for the house. And the girl started having some strong issues and emotions. And they had history in the family of bipolar. And so it was on the parents' radar. And now, you know, there's a lot of other things that we do with the child. It wasn't like that was the one answer, but that was one thing that we looked into, and it was just, it correlated with that family. So
and
it's pretty
just so
interesting.
Like people know, because when you hear that, a lot of people are going to be like, what the F? That sounds so woo-woo. And like,
I mean, I think it sounds
who is this
woo-woo,
like
but
kook? But I will tell you, like, the neurologist who does the reading, like, that's not something he says with every reading.
No, that's the one time I've ever heard him say that. And again, it wasn't the only thing we did. It's not like we closed the case and said, okay, mom, go take the Wi-Fi's out. Your daughter's going to be normal. No, I mean, we work on her diet. We do the nutrition. We do the genetics. We do the gut. I mean, you have to do everything and work on somebody. And they notice differences. And no, we don't know what exactly caused the difference. We know everything helped. But I mean, there's probably from 9 hotspots in your house. I mean, you know.
I mean, it's emitting electromagnetic.
Right. Why do you need 9? I don't understand.
I'm
not sure.
Everybody's
I don't know the 9.
Wi-Fi.
Like
what?
She was upgrading and trying to do something. I guess their house is
9
large.
hotspots?
That's a lot.
That's a lot of hotspots.
Maybe she has 9 kids.
Question. Can you course correct bipolar? No.
I think. Okay, so if you know someone has a genetic predisposition and they have, like, if they do an Evoke and there's signs that like maybe their brain is starting to develop in a way that would like push them further down that path. I think there's definitely things that you could do to try to course correct. I don't think it's like 100% given, but I think there's for sure things you could do to try to course correct.
Like I feel like anxiety and depression, I feel like you can course correct.
And maybe avoid some medicines. I mean, wouldn't there be medicines you'd want to avoid if that was the case? You know?
I definitely think you could course correct. I mean, we know like for schizophrenia, it's not just that you have the genetic predisposition and then you like for sure develop it, right? There has to be some kind of environmental trigger to cause your brain to like go down that path, right?
Yeah.
So we know there are things that you can change in your environment to like try to shift the brain in a different way.
Okay.
It's just not 100%.
Yeah.
But you might be able to make it like less severe,
Yeah. And be on like less, what's it called? Whatever, go.
And like you're ideally in that process, like the person is learning ways to try to like improve their brain health and like cope with whatever they're dealing with, like they're learning like, okay, if I exercise regularly and I, limit my alcohol intake and I don't use substances and I, eat this certain diet, that like my brain is going to be healthier than it would be otherwise. And like, I have to do that because I have this predisposition.
Yeah. 100%.
I'm going to say the stupid thing and then let's keep going. Rick tried to make me watch this, God, it's a documentary. I think it's like new. It's about carnivore or whatever. Have y'all watched any carnivore or anything recently?
I've watched the one where they put the people on the carnivore protein diet, then they put them on the high carb diet, and they see the benefits. It's not that one.
No, this is about like it's all men, and they're all jacked, and they're all tan, and they're all like, and it's like everyone's like on a like in the plains, like with a straw out of there. And anyways, and it was just like so it was so Rick, he was like, yes, like just
let's
like
go. So intense.
Go. Like making his own beef jerky in the fucking whatever. Anyways, but it's just, you said diet, and I was just thinking about how like there's just so many different diets that are good for, you know what I mean? It's just like,
well, when I say diet, I don't mean going on a diet.
No, the best way to say that is like just whole foods, right? Just filling your body with foods that are nutritious for you and eliminating the ones that aren't.
Yeah. Okay, next.
Okay, so let's do my colleague. Her son is 13, and I know we'll show you guys this, but he actually has 3 Evokes. So he was one of the first ones we've done, and then we did another one a year later, and then so like each year he's had one, and every single marker on his EEG has improved, from his ability for his brain to just work better, for his focus, for his impulsivity, his attention, and he was actually on a stimulant and got off.
Sweet.
Because the Evoke was showing that there are some signs of mitochondrial effects, and stimulants and meds can do that, and so the mom really struggled with it because she felt he needed it, and he probably did, but eventually we were able to get him off of it. But every single thing got better, and then, these are his 3. So lots of red, no green, right? You're starting to see the green come out, and then much more green, almost primarily green in the third picture.
Cool.
And so for him, it was his attention, his focus, his processing speed, his impulse, his sleep, and everything has improved over 2 years. But you can see how much time it takes, right? Because he's 13.
Yeah.
So it's not going to happen overnight. And that's why we ask people to stick with us and really work on it slowly. The cool thing is that he's doing really well, and he's in high school, off of meds, has a 3.2.
Sweet.
That's
doing
awesome.
Wonderful. Socially as well. But there's so much more to do.
Yeah.
Oh, yeah.
So it's just cool for that mom to see that and say, wow, like we have more work to do. Like we are in this for the long haul.
Yeah.
But I mean, to continue to improve each step of the way is just really cool.
And like people just want a quick fix.
Exactly. So the last but not least Evoke that is really cool, and you have to do one like every year so you can keep tracking your brain, which will be awesome. But Dr. LaRose's Evoke, we did her post recently, and so it had been almost exactly a year between your 2. And so just to jump to the chase, the really kind of cool thing is Lauren is like a genius. She's extremely smart.
Which is funny because I have never in my life thought that I was smart.
Well, because you're a whole different can of worms. That's a whole different can of worms.
Her cognitive potential, your peak alphas, what it's read on here, is extremely high. And I think that correlates to a lot of things that you experience, right?
Yes.
You have a very high functioning brain, right? You own a business, you do lots of multitasking and your family, and then you put a lot of pressure on yourself, right? Which a lot of us MDs do. And so that was cool to see. Lauren beats Jessica in their cognitive. No, I'm joking.
She does, but how much?
If we want to compete, 11.4,
okay.
10.9.
Okay,
which is super high too.
But
yeah,
listen,
super high. Super high.
If I didn't drink
way
a
higher
bottle
than
of wine
normal.
every night, I bet I would have.
You probably
scored
will.
higher.
Yeah.
Let's eliminate that wine and redo it.
Redo it. But the biggest thing for Lauren that we saw got better is the ERPs, which is the event potential. And that is really cool. So there's a P300A, a P300B, and an N100. And all that means is that's the processing speed in the brain. And it's called the ERPs. And all of Lauren's got significantly better, all three of them. And so that means that all of the power and the latency of all those things improve. What does that mean? So her attention got better, her focus got better, her memory got better, her sensory processing got better. And so that is pretty awesome to see within a year in an adult, especially because she is high functioning and has a lot of stress and has a lot of weight on her, and she hasn't stopped. She didn't stop and slow down and do a whole lot of anything except really just work on her body, right? Her med. You can kind of go into what some of the things that you've done.
Yeah. So
but what was it before? What was the issue before? Or like what were you fixed or whatever?
I would say the main issue of like what I was experiencing was like really extreme fatigue.
Yeah.
And just like feeling like so like dragged down, you know? And so I will tell you, really what I did, this improvement is not with medication.
No.
I'm not on medication. This was like working on my thyroid, okay? Because I have Hashimoto's, hypothyroidism. And so it was like getting on a different thyroid regimen. I am on a ton of supplements, I will tell you. I'm on a ton of supplements. But like they're helping. And then I changed my diet, which I will tell you, I am definitely not perfect with my diet. I have a lot of room, I have a lot of ways to go. But I knew like there were things in my diet that were worsening my inflammation and worsening my Hashimoto's. So like I cut out gluten almost 100%. I'm pretty close. And then like this tiny little change that I did that I think made a huge difference. I stopped putting sugar in my tea in the morning and I used honey instead.
Right.
Oh, yeah.
Okay. And I will tell you, I think my skin is like significantly better since doing that. And I'm like, God, I wish I would have known this at 13 years old. When I've had acne my entire life. I've had acne my entire life. Okay. So cut out gluten, cut out the sugar. I did change my exercise. I do like a lot more Pilates and yoga now, as opposed to just like running forever. And I started supplements for sleep, which have made a big difference. So like all of these improvements, and like I still have a lot of work to do, but we're just like with like lifestyle and because now I'm like
what
more blue.
Oh, is this? I was about to say, is that considered blue?
Yeah.
Oh, okay.
Yeah. So it's interesting, right?
Like
here. God, how different.
So this, even though you're seeing red here, right? This means that the red means the power was too high here, meaning she was slowed. That's that fatigue that she's seeing, right?
Yeah.
Okay. So the red, even though it's red, that means slowed. And so now there's no red, right? So there's no high power. There's some low power in the middle. Some low power in the middle. And so the slowness and the fatigue, her brain is functioning better, but she has some of that low power, which she may not notice too much, but we do need to figure out more. And so there's a lot more work to do, right? So getting labs metabolically, what else can we do to our cortisol? So remember, the brain and the heart are always talking, right? And so if you look at her heart waves.
Not good. It's not good.
You're in the parasympathetic, right?
Yeah.
Right, because the brain's too busy and it's telling the heart rate variability to be a little lower.
Here.
I know. I don't think I have that printed out.
I know, but wait. Okay.
No, I'm sympathetic.
Right. I'm sorry. Right. You're sympathetic. Yes. As I'm saying it, I was like, yeah. So because your brain is low, your heart rate variability is going to be affected. And so you're living in that fight or flight.
Yes.
Right. And so she's on edge and she's feeling very, like every hypervigilant
on a wheel.
Yes. Like,
well,
and
you are.
I'm just like,
but you are.
I know.
Like, I mean,
I go to
and that's more for physiological body.
Yes.
Compensating for that low power.
You're never taking you're not. Yeah.
Yeah. We all know that.
Yeah.
We all know that I work too hard. I do too much.
I feel like this is representative of your lifestyle.
Yes. Correct.
Like I don't know that it's like like all the supplements and stuff are good. I also believe that like if your lifestyle changed, you may not. It would be a beautiful like.
Oh no, I 100% agree. Well, and honestly, it helps me to see it in black, not black and white, but whatever. Because people can tell me that all day long, and I'm like, whatever, you know, and I'll just go, keep go. But then when I see it, I'm like, holy shit, like, okay,
that was the
this
same way.
is like I can't deny this anymore.
Well, no, it's your brain, and it's being affected, and you want to live a long life, and you want to have a healthy brain.
Life expectancy, like this influences life expectancy.
All
right, so let's start wrapping up. Medical community. I mean, it sounds like Children's is now doing something with Evoke. Insurance doesn't cover this, which is a big old bumski.
Yeah.
It ain't cheap.
Some types might, but it has to be billed on your end.
Like
and I think if the hospital systems are using it, they have some Medicare, Medicaid systems that may be covering it.
Or like could a grant.
Yeah, for sure. That's what we're working on our end, and with some organizations to see, you know, what could we do to kids that don't have this accessible to them, and could enter in a program like ours or someone else that could have huge benefits.
Because it's not cheap. Anyways, but it's relative. This is new. This is like a new thing.
Evoke's been around for a really long time. Sure. I think there's been doctors that have done it so I had told Lauren that there's a functional integrative psychiatrist up north that has implemented this in her practice and is, you know, extremely busy. And there's a few practice, you know, a lot of people do the Evokes. I would say not as many do a volume on pediatrics. And so, you know, it was a little bit more lacking in the data on the ped side, but I have read a good bit. And clinically we see it's always helpful. Like I said, I've never had a case where it's not. It's always relevant. It's always relevant.
Correct. Anyway, so like if the medical community could get behind this more and work as a team more and maybe reduce the price, then more people would be able to get it.
100%. That should be a goal.
Yep.
Definitely.
Yeah. So we already talked. Yeah. So that's, I mean, I could talk about this for days.
Well, and pairing this with, I guess to recap, right? Yeah. Pairing this with the genetic panels, specifically the ones paired to the mind, right? Looking at the inflammation, looking at the neurotransmitters, the stress responses and stuff can be extremely helpful, because sometimes we'll meet with the team and they will recommend GABA, right? For a busy brain. GABA calms down the brain, right? But that genetic panel on that patient, their GABA works great. Their serotonin does not. So for that kid, or adult, we really might want to hone in on their serotonin and support that either with supplements or even if we have to medication. And maybe plus or minus use that GABA, but with this, you may not know. And so pairing them together, it's like a win-win because you have all the information.
Yes. All right, well, I'm going to schedule my DNA, whatever you just said, so I can see.
You will love that. It's very science.
So cool. I mean, it is so cool.
Real data.
Can I'm going to try to list all these out. Dopamine, GABA, serotonin, and
Tropic.
Damn, that was close. Neurotropic.
Sure.
Neurotropic. Can those hormones be influenced by environment, trauma, lifestyle, or is that
100%?
Okay.
And remember, all of your serotonin, 99% of it is made in your gut.
Oh, God.
And the bacteria in your gut. You did your gut?
No, I didn't do my gut.
Okay. Well, there's bacteria that can be in the gut. People call it dysbiosis, whatever you want to call it. But basically, if you have staph, strep, different bacterias, that steals your serotonin inside your gut.
Oh, yeah.
You have lower levels. If you heal your gut, if you work on some things, right? Your diet, avoid harmful things to the gut, antibiotics, etc., and you heal the gut, your serotonin is going to work better no matter what.
Right. No matter what your genetic predisposition is.
I don't want to do it yet because I'm still
You're
drinking.
Not ready for the answers.
I'm not ready. Well, I'm ready for the answers, but I'm not willing.
You're ready to make a change.
Which is terrible.
But maybe if you see it in black and white, then maybe you would be.
If you see your gut and it is like a mess, like mine was, you are going to want to get that stuff out.
I think so. I think you will. I mean, look, I never in my wildest dreams thought that I would do anything to change. And now I'm finally like, okay, I got to do it.
I'm changing from my trauma whatever the Evoke.
I think you should do it.
I'm going to do it. I just really don't. Anyways, I just don't want to stop drinking. Anyways, okay. Well, we got to have you back. It's so hard to nail you down. You're so busy. But we are going to have you back, and this was so great. So
I know.
for coming in.
We could go on for hours.
Thank you.
Hours and hours.
Yay.
Okay.
Goodbye.
Bye.
Thank you for tuning into this episode of the Little Brain Campaign podcast.
If you enjoyed our conversation, give us a follow on your favorite podcast platform so you never miss an episode.
And hey, those ratings and reviews, they actually matter, like a lot. Take 30 seconds to leave us a review while you're still thinking about it.
Until next time, remember, we're all just trying our best.
See you next week.